Welcome to Frank Wealth Insights, a financial and investment podcast from Return on Life Wealth Partners. They look at your money. We look at your life at returnonlifewealth.com.
Let's look at your life. I'm Frank Fantozzi, and I'm president and founder of Return on Life Wealth Partners. It's hard to believe, but we're celebrating our 30th anniversary, and I couldn't be prouder of our team at Return on Life Wealth Partners. So I'm really excited today because I'm joined by our special guest, Rodika Koloda from Insurance Systems. And Rodika, how are you doing today?
I'm doing great, Frank. Thanks for having me here.
So Rodika's a Medicare expert, and it's something that is very common that we all have to deal with. We all, if you look at your pay stub, you'll see that 1.45% comes out and goes to the federal government, plus your company matches that. You want to know what it's for. So the reason why we're here is for Rodika to share her expertise, because it is a very important benefit that we all have that's provided by our government, but many people don't understand basically what it is, how it works, what are some of the common mistakes that can be made, and there are methods of maximizing your benefits. So Rodika is going to open up and tell us all these things that we should be knowing and thinking about. But first, tell us a little about yourself and Insurance Systems and what you do.
Yeah, thanks, Frank. It's such an honor to be able to be here and to be able to speak with you and share, the knowledge on Medicare with both you and your clients. A little bit about me. I have been in the insurance world for about 26 years.
Just a little bit of time.
A little bit of time, yeah. I always say I grew up in the insurance field. I did spend about 10, 12 years on the group side when I first started. And then the last 15, 16 years, I've been on the Medicare space. Do a little bit of everything. I still do group insurance, individual insurance, but Medicare is really my primary focus. It's really more of a passion for me than the other lines. I really like to be able to come alongside my clients, educate them, because it can be so confusing and overwhelming. So to help just reduce the anxiety of Medicare and just show them that it really is it can be a simple process.
I'm sure with your help, it is very, very simple. So why don't we kind of level set the table? Why don't we explain what Medicare really is and why it's crucial to individuals as they start to move into retirement into their 60s?
Well, as you're working, or if you're self-employed, you buy your own insurance, right?
Okay.
And like you said, through paychecks, you see that all your FICA taxes is going towards Medicare, but you really don't know or don't see what that coverage is until you are eligible for Medicare. So that's exactly, Medicare is a federal health program that when you turn 65, or for individuals that are under 65 that are totally disabled, after 2 years of total disability, you'll automatically be enrolled into Medicare.
Okay, wow. So what does Medicare exactly provide? You talk about it as a health insurance program. So I'm thinking back to, okay, this is really like universal health insurance that's really provided by the government. Is that like an oversimplification or?
It is kind of. I always explain it's a catastrophic plan, and it's not going to cover everything for you. So you have multiple parts of Medicare. They will cover medical coverage. It's not going to cover prescription coverage. It's not going to cover your ancillary benefits like dental, vision, hearing, things like that. So
So does it get into like preventative services, chronic disease management? What makes up Medicare in regards to what it does provide? And what are their options on things that isn't covered by Medicare?
Yeah, so it's going to work very similar to the coverage that somebody has in place prior to turning 65. It's just you're going to have different parts of Medicare.
Okay.
You're going to have coverage for hospitalization, skilled nursing, hospice care. That's all covered, and we can get into the specifics of all the different parts. And then you're going to have coverage for your doctors, your outpatient services, preventative care, things that Medicare does not cover. Will be additional coverage that you would have to pick up to avoid penalties. But Medicare themselves is going to give you the bulk of any kind of medical coverage that you have currently through a private or commercial plan.
Okay, so it's your basic foundational health insurance program.
Absolutely, yep.
So, so things like hospital emergency care, mental health services, would that also
absolutely
fall underneath?
Yeah, you're not going to see any kind of limitations or breakouts where they're not going to cover, certain things like, chemo or again, preventative care. All of that is going to be fully covered by Medicare.
So really it's transitioning from my work health insurance, and then when I go into retirement, and usually I think it's the age 65, correct?
Right.
Is when you can apply for Medicare. So what are some of the things people have to do if they decide to retire early and both spouses retire, or I'm a single person and I'm age 60, I can't get Medicare, correct?
Correct.
So what do I do in the meantime?
So then at that point, you would have to pick up, a short-term plan that would just cover, like bridge the gap. Most individuals then will just pick out an individual policy on the marketplace that will give them the full coverage until they are able to transition into Medicare. Okay,
so this is my base health insurance program. How do I start the process to get into Medicare? So, I as I said earlier, I think you have to wait till you're 65. Is there a window that I have to apply for? And what are the things I need to make sure I do so that I don't miss my opportunity to get into Medicare cleanly?
So if you are collecting Social Security prior to turning age 65, there's technically nothing that you need to do because the Social Security Department will automatically enroll you into Medicare Part B.
Okay.
You're automatically enrolled into or eligible for Medicare Part A when you turn 65, so there's nothing that you need to do to be eligible for Part A. Part B, because there will be a premium after you turn 65 that you will pay for the remainder of your lifetime, that is something that you actively have to enroll into.
Okay.
So most individuals, you have like a 7-month window to enroll. 3 months before is really the window when you want to start the process of enrolling into Medicare. So if you're not collecting Social Security benefits, then you will want to go on to really the easiest ways to go on Social Security's website to be able to enroll.
So that's what I was going to ask. Where do I go to sign up? And what's really the difference between Medicare Part A and B?
So Medicare Part A is, I explain it as anything that will require you to be in a hospital bed to receive care. So inpatient hospitalization, skilled nursing, and hospice care. And so when you're working, you are paying those FICA taxes. You see that going towards the Medicare benefits. That pays for your Medicare Part A. So when you turn 65, there's no more premium that you have to pay for Part A, because as long as you earn enough work credit hours, that gives you the Part A at a 0 premium.
Okay, great. That's good news. So really and when I apply for what you're saying I apply for my Social Security benefits, Social Security will help make sure I'm dovetailed into Part A.
Correct. Yes.
So let's talk about Part B. So that seems like that's where people can miss the window or create problems. So what do I need to do to make sure Part B is all working right?
So if you're not collecting Social Security benefits, then it's not an automatic enrollment. So this is something that you then again have to either go to Social Security's website and set up an account and enroll yourself into Medicare Part B.
During that 7-month window.
Right, the 3 months before. And this is really for talking about somebody if they don't have coverage that will continue past 65, right? So it's somebody who is retiring, now they need to have their own benefits put in place. So 3 months before your 65th birthday, you'll want to, again, go onto Social Security's website. You could even go down to the Social Security office and they'll help you enroll into the Part B, and then that will take effect the first of the month that you turn 65. So regardless of what day your birthday falls on in that month, Medicare is always going to take effect the first. So, and then the Part B, the reason why you have to actively enroll yourself into Part B is that there is a premium that you'd be responsible for upon enrollment. So again, if you're not collecting Social Security, there's no way for them to draft those premiums, which is why they require you to actively enroll yourself.
So situations where I have to pay attention is if I continue to work and I'm covered, so I don't need Part B, correct?
Yes and no. So
that's why you're here.
So it could be a little complicated because you always get, if you don't enroll when you're eligible, you can potentially have a penalty. Now, if you are working and you're going to continue working past your 65th birthday, if your employer has more than 20 employees, your Medicare is secondary, so you therefore can delay enrolling into Medicare Part B.
Okay.
Because your group plan would be primary, Medicare would be secondary.
Okay.
There's no reason to pay for both benefits.
Okay.
If your employer is less than 20 employees, Medicare's primary. So
Wow.
regardless if you choose to stay on your employer plan or not, you still have to pick up Medicare because now Medicare's primary, group plan is secondary. If you delay enrolling into Medicare, your group plan will pay secondary. You yourself are responsible for that primary.
Wow. Not a good situation.
Yeah, it is. And then if you delay that enrollment and it's shown that you should have enrolled at the time of your 65th birthday, you then will pay a penalty for it. So again, it's kind of, okay, what is the size of the employer group?
Okay, that's good. That's good to know. And then I think I can see why some people might forget about Part B is if they, they're delaying, they're retired, and then the other is they're delaying Social Security. They think they're automatically enrolled in A, and they're thinking they don't need to do anything for B. So it's really important for those that are retired that if they're delaying Social Security benefits to age 70, for example, which sometimes makes sense when you're doing Social Security planning, you still have to actively go in and make sure within that window around your 65th birthday that you're signing up for Part B.
Right.
Okay.
Yeah.
Wow, that's great to know. So when I'm applying for this and I'm on my basic medical coverage, you mentioned there are like add-ons and there's different types of programs for Medicare. So can we maybe dive in and look like, hey, I do want vision and dental, and most of the time, I'm popping pills, I'm taking drugs for something, right? Something's wrong with it. As we age, there's usually something I got to take something for. So how do I make sure as best I can? Because when I was working, I had vision and dental and prescription and my basic medical coverage. How do I recreate that once I'm retired? Because those things don't go away in my life.
Right. And the need for most of that increases as we get older,
Oh,
right?
Yeah.
So again, just kind of going back to what you get from Medicare. The Part A is your inpatient services. The Part B being all outpatient services, your doctors, your outpatient, like surgeries and testings, emergency room is covered under Part B. What is not covered by Medicare? Where you said popping pills, right? So your prescriptions, your maintenance meds that you take every single month. Now you are required to carry prescription coverage.
Okay.
If you don't carry prescription coverage, you will get penalized further on down the line when you go to pick it up. But Medicare themselves does not cover prescription coverage.
Okay, so I come to see you and I said, all right, you help me with the process of filing. How do I pick what programs? Because I heard it's like alphabet soup, right? There's these different programs out there, B, C, F, and D, and so what should I be thinking about? And there's this thing called Medicare Advantage. So how do I, if you can't walk us through the decision tree of what my options are for my health insurance, and do I consider Medicare Advantage? What's the trade-off? How do I get vision and dental? How do I actually put that stuff in place?
Right. So just know you get Medicare A and B, your hospitalization and your doctors and outpatient services from Medicare.
Okay.
And then from there you have two options. The first option is doing a Medicare supplement and adding a standalone prescription drug plan. So a Medicare supplement does what it says. It supplements Medicare.
Okay.
So whatever Medicare covers, your supplement is going to cover what your responsibility is under original Medicare.
Okay.
You end up in the hospital, you have an initial deductible that you're responsible for, your supplement pays that.
Okay.
So it works in tandem with Medicare. You budget things on the front end because the supplement's going to have a premium.
Okay.
So you pay a premium on the front end so that you don't necessarily have to worry about expenses on the back end.
Okay. So it enhances my coverage. It makes my coverage, I'm paying more for a better insurance plan. Is that fair to say?
Well, I don't know if we can say better, because better is based on how you want your insurance to work for you.
Okay,
so
fair.
For a supplement, it's how do you want to budget your health insurance? You can choose to budget by paying a premium, so you don't have to worry about paying deductibles and co-pays on the back end.
Okay.
You know what your premium is on the supplement. You pay that every single month for 12 months. Premiums go up every single year, just like like everything else in our
Okay.
life, right?
Right.
But you know exactly what you're going to pay. There's no surprises with that. And again, because a supplements what Medicare pays for, you then would have to pick up a prescription drug plan because Medicare, again, if Medicare doesn't pay for something, your supplement can't pay for it either.
Now, are there different types of drug plans as well, or is there just one drug plan?
No, there's definitely many different drug plans. So selecting that would be determined on what somebody's currently taking.
Okay.
It's not a one size fits all. It really is. Because depending on counties where you live will determine on how many plans you have available to you. So you would want to do a prescription analysis comparing all the different plans that are available to make sure that your specific meds are covered at the highest level possible. So then kind of going on to your second option, the Medicare Advantage plans and how those work. Many of those plans are different from the supplement because many of them don't have a premium.
Okay.
What an Advantage plan does for you is it takes your Part A, your hospitalization, your Part B, your doctors and outpatient, and then Part D, so it's a part of Medicare, although it's not covered by Medicare, so D for drugs, and it puts it all into one plan for you.
Okay, is it like an HMO then, kind of?
There are HMOs, there are PPOs, they are POS, point of service type plans. So the Advantage plans are network based, whereas a supplement, your network is Medicare.
Okay.
So wherever you go within the United States.
Does everyone have to take Medicare? Every hospital? Every doctor?
They don't have to. They can choose not to. Every state has different laws. Like in the state of Ohio, a doctor can choose not to accept Medicare. However, they're legally not allowed to charge you more for the service that they're providing than what Medicare allows for it. So in the state of Ohio, it's going to be very difficult to find a doctor who doesn't accept Medicare. Whereas in other states, they have different laws that may potentially allow a hospital system or a doctor to select if they will or will not accept Medicare.
Okay. So if I go to these Advantage plans, it's kind of like one price, this is everything I get, but probably the trade-off is that's where I probably have to work more with a network at that point.
They are all network-based, just like your...
That's the trade-off with not having, one set premium, probably low deductibles or no deductibles and things like that.
Yeah, it could be, but it works a lot like your group plan. Okay. So, locally speaking, right? So you're used to saying, okay, I have group insurance and most group plans are going to give you access to all hospital systems. On the Medicare Advantage side, if you're sticking with the larger carriers, they're going to have a full, robust network.
Okay.
And a lot of those carriers even have networks outside of the state that would allow you to access care. But you still want to be mindful of networks and looking at the doctors and making sure that everybody you need and want to be treated with are part of that network. Because I would say I like surprises, but not when my client calls and says, hey, my doctor doesn't accept this plan. So, you always want to be mindful and take a look at that.
So that's kind of the decision process you help your clients. I know when we refer clients to you, you kind of really try to understand what the client needs are, their medical history, the type of drugs they use, what doctors and specialists they have. And then you kind of go through that cost benefit analysis and say, all right, kind of like creating custom clothing is, you'll help try to tailor as much as you can the drug program, the Medicare program and all that.
Right. And somebody's lifestyle too, right? So it's, are you retiring and just staying central in Ohio and not really traveling as much? Are you now going to become a snowbird and spend part of the year in another state? So then how does your insurance work when you are going from one state to another state? So again, different plans will help cover somebody based on how their lifestyle will change once they turn 65.
What about international travel? You brought up travel in different locations. I got to wonder, I know sometimes when we travel with our group plan, you want to make sure coverage is there when you go out of state. So how does that work?
Internationally, so Medicare will cover up to $50,000 in emergency care internationally. So then your supplement would as well.
Okay.
And then the Advantage plans also will cover some international. Every carrier is a little bit different on what that exact dollar amount is. But, honestly, I always recommend somebody to pick up travel insurance. It just, There's a lot of benefits to having it, especially in the case of an emergency. It's not that you just have this coverage that will help pay for that emergency, but it also helps coordinate care. So if you're somewhere and you don't know where the nearest emergency room or a doctor, it'll help coordinate that, and then it coordinates with your Medicare benefits. So I really, as peace of mind, just to make sure that you're fully insured, I would recommend that. But.
So now once I get done and I pick all my stuff, am I done for the rest of my retirement, or is is there a check-in or a review process? How does that work?
Yeah, I always recommend reviewing it every single year, because the coverage that you're picking up at the time that you are aging into Medicare, life changes, right? And
right.
I always say, life happens to us. So, I always say, okay, I think that people naturally are going to gravitate towards what they're comfortable with, whether it's a supplement or an advantage plan, but then just knowing during the annual enrollment period. So from October 15th through December 7th is the annual enrollment period. And so during that time frame, you could take a look. Okay, here's my plan. How is it changing for next year?
Okay.
And how does that compare to everything that is available? So for somebody who has a Medicare supplement, again, you're paying that premium to cover all your medical expenses. That's probably not something that you're going to need to change every single year. But because you're fully insured, right, between Medicare and your supplement.
Correct.
But your prescription coverage. Now, you might have started out and not really been taking much as far as your medications go,
right.
But now you have
getting
more,
older,
right?
More aches and pains,
right? So you always want to check how your prescription plan is changing for next year. And a lot of times, I'll get clients who say, "Well, the premium's not changing. My medications are pretty much the same. I'm just going to stay where I'm at." Which is great, because you could see where your plan is changing for next year. You could see the premium, you could see that initial deductible, and you could see what your copays are. But what you don't see is, how did that plan's formulary change? Mm-hmm. How are your prescriptions still being covered at the same tier?
Or not covered anymore.
Right. So you want to make sure that suitability matters when it comes to the prescription plan. And that's regardless if it's a standalone prescription drug plan or if it's a Medicare Advantage plan, because the Advantage plans cover all your prescriptions as well. So you just want to make sure that the plan that you're on, at the very minimum, that your prescriptions are covered at the same level as they currently are.
Now, is it the same time every year, or is it based on your birthday? Is it based on when you originally sign up, or when is this period that you should be reviewing it, and then if you need to make a change, when do you make the change?
During the annual enrollment period is when you'll make that change. So anything that has prescription coverage tied to it will be tied to the annual enrollment period.
And when is that?
So again, that's October 15th through December 7th.
Okay, so I got to be thinking about this over the summer, so that when I get to October, I kind of know what I need to do.
You at least need to start having that conversation of, okay, like for our clients at Insurance Systems, we always send out a letter before the annual enrollment period. So before even all the TV commercials start.
It's like elections too, right? They're all out there flooded with them.
So, start having those conversations of, okay, how has the past year been for you? How has your coverage worked for you? Making sure that we have updated information so that when the system opens up, we can start running the scenarios for you and making sure that what you have currently will continue to be suitable going into the next year. Your supplemental plan is not tied to the annual enrollment period, which many people don't know.
Wow.
So, and again, your supplement, the premium on those are going to renew depending on the carrier that you're with, but typically it's going to renew when you picked it up, right? So, which is the month of your birthday.
Wow.
So when is your birthday? Is it in April? It's in renewing in April. Well, if you get a high renewal in April, you don't have to wait until the annual enrollment period to be able to price out your supplement and potentially switch
so they're
to
not
another
really
plan.
linked.
They're not.
Okay.
So it's your standalone prescription drug plans, your Medicare Advantage plans are tied to the annual enrollment period. Those are when you want to review those, compare how it looks against all the other options that are available to you. And if you need to make a change, that then will go into effect January of the next year.
Okay. And I hear this term thrown a lot. It's Medigap.
Which is a supplement,
it's
right?
Just it's another supplement?
Right? Yeah, it's just another name for a Medicare supplement.
Okay.
Yeah.
So what are the different letters mean? So I think that sometimes gets confusing. We talked about A and B. What are the other letters that represent the other parts that are supplements, and what do they apply to? So we kind of set the record straight here when thinks through this.
Right. So again, A is hospitalization, B is doctors and outpatients, and that's what you get from Medicare.
Okay.
So as you're enrolling through Social Security, so you're not going to go to Medicare to enroll, you're going to Social Security to help enroll you. That's what you get from Medicare. Part C is Medicare Advantage,
okay,
which again is not a part of Medicare. It's an option to Medicare.
Okay.
So if you enroll into Part C, it's going to take all your other parts of Medicare and it puts it into one plan for you.
Okay.
And then Part D, I always say D for drugs.
Okay.
That's easy to remember.
Yeah,
right?
That's an easy one.
So.
And is there an F?
So when you're talking about F or, really A through N.
Oh, wow.
There's
even more letters.
There are. So but most individuals know F, G, N. Those are supplemental plans, or like you had mentioned, Medigap.
Okay.
It means the exact same thing.
Okay, so supplement and Medigap are really one and the same.
It is the exact same thing, right? So just like you can say Part C or Medicare Advantage, that means the exact same thing.
Okay.
So the supplemental plans have different plans that you can choose that will determine what it does and does not cover under your responsibility.
Okay.
So again, because the supplement works in tandem with Medicare, Plan F is no longer available to individuals that are just aging into Medicare. If you aged into Medicare prior to 2020, you continue to have the option of having a Plan F. So if you're on an Advantage plan now, you were in part of Medicare prior to 2020, and you want to transition over to a supplemental Plan F, you can do that. That's an option to you. If you are just turning 65 now, that Plan F is not available to you, which really is not that big of a deal. You have other supplemental plans that cover pretty closely what the F did. So you have the Plan G, you have the Plan N, and those really are the more comprehensive plans. If you're going to go the route of a supplement, you'd either choose one of those two. Okay.
Now, how's my premium determined every year? If I'm on just the government plan, not to complicate it with Advantage and everything else, you said my premium, can change every year. How can it change? And is there any penalties if I'm still working and making money and all that kind of stuff?
Yeah, so again, Part A, when you retire, there is no premium for Part A. Because again,
you paid into it.
You've paid into it, right? If you reached your 40 work credit hours, you get Part A, 0 premium.
Okay.
Part B is what you'll always have a premium for, and that is based on income.
Right.
It's based on household income. So depending on what you earn, what your spouse earns, that will determine what your Part B premium will be. And there's a whole tiered factor of, where you potentially could fall.
Okay.
So that will, so when you go to enroll, Social Security will look back 3 years and see what your combined income
average
is.
Income over the last 3.
Correct. And then they will advise you as to potentially what your Part B premium would be.
So it becomes a little more needs-based is the best way. So the government's saying, hey, for people that are not making as much money, we need to make sure they have coverage that they can afford. So based on their household income over the last 3 years, they're going to say, this is your premium. If you've done well and you're having a great retirement and you're making good money, you could expect to pay a much higher premium.
Correct.
Okay.
Correct. Right. And then that would continue. So a lot of times you'll have somebody who falls in a higher tier, but now they're retiring and their income is nowhere near what they were earning.
Right.
You then have the opportunity to go back to Social Security and kind of state your case and say, hey, this is what I did earn, but this is what I'm expecting to earn, if they're not taking access to any of their financial accounts that they may have. So they could go back and say, okay, this is what I'm expected to earn. It's falling under a lower tier. Prior to 2020, Social Security would say, there's a 2-year window where you just have to pay that
For a
higher premium. But since 2020, they've really been more lenient on that. So if somebody does find themselves in that position, having to pay that higher premium, but knowing that their income is going to be less than what it was,
you can appeal your
previously,
case.
You can appeal it, and in most instances, they have been helpful with recognizing that and helping to reduce that.
Okay. So with a little bit of time we have left, is there other ideas you have in maximizing your Medicare benefits? Like either at the initial enrollment period, there's this term called MSPs, Medicare Savings Plans, extra help for prescription drugs. Are there like ways to kind of maximize those benefits so that you're getting as much as you can for what you're spending?
Yeah, so the MSPs really are not available in the state of Ohio.
Okay, good to know.
So locally, that's not something that you really need to worry about. The Extra Help program, that is a program to help individuals with the cost of their prescriptions. There's 2 different avenues of getting that extra help on the prescriptions. One, Social Security has the extra help. So anytime that I talk to a client, I say, call your local Social Security office, never call the 800 number. You'll be on hold for days. Call them and just tell them that you want to see if you're eligible for extra help. And then they know that you're asking about their prescription plan. And then you could always go to Job and Family Services for your lower income individuals, that they then can also look, okay, are you eligible for assistance on just reducing the co-pays on your prescriptions? Why that's beneficial for some individuals if they are eligible to benefit from that program is that, especially for clients that might be exposed to the donut hole or the coverage gap on the prescriptions. So we really didn't get into that, but that is
come on, take your time, get time. I'm interested in this donut hole.
Yeah, right. I always say
I'm getting hungry. It's breakfast. And I'm mentioning donuts.
Right. I always say it's the donut that nobody ever enjoys.
Yeah.
It's when your overall initial the amounts go up every single year.
Right.
So like for this year, the retail cost of your medications, if they equal $5,000, you then fall into the donut hole or coverage gap. What does that mean to you? Is that once you fall into that, a lot of plans, prescription plans, you now are responsible to pay for the full cost of your generic meds.
Wow.
Okay, that might not be that big of a deal, but you didn't fall into the donut hole because you are taking generic medications. You fell into the donut hole because you're taking some pricey medications.
Right.
So now you're in the donut hole and you're having to pay 20 to 25% of that monthly retail cost of your medication.
Wow.
So
people on fixed incomes, that becomes a problem.
Right. Yeah. So you were paying $40, $45, $47 for a 1-month supply of a tier 3 medication, and now you're paying 25%, and the retail cost of that is $800. Well, that's a huge difference, right? So when somebody has that as something that they're exposed to, that extra help program, it sets what copays they pay on their medication. Okay. So their generic meds, they're going to pay minimal copays. Their brand name meds, it would be capped at $7, $8 a month. They're still going to technically fall into the donut hole, but their copays are set, so it doesn't matter.
And who do I go to see about the donut hole? You or
yes, yeah. So you would want to work with an advisor where we would be able to, again, which is why I always emphasize looking at your prescription coverage every single year matters, because it really potentially, sometimes you could completely avoid the donut hole. Yeah. Other times maybe there's no way to avoid it, but maybe by switching the plan you can maybe delay it, or there's different ways to strategize. Okay, so if you just use like GoodRx for your generic medications, that gives you more funds to go towards those brand name drugs and give you a little bit more coverage. So again, that's something that I get pretty analytical when it comes with that.
Well, you have to. It's interesting. I mean, I take a couple prescriptions, nothing crazy, but the pricing of this stuff is like out of this world. And all of a sudden, you mentioned GoodRx. Pharmacist just all of a sudden magically uses GoodRx and it drops by 90%, and you're scratching your head and go, well, how does that really work in the real world? How do pharmaceutical companies, and they're a business, they deserve to make a profit at creating drugs that make our lives hopefully more comfortable, better, yet, with the wave of a magic card, my price gets cut by 60%. And I'm like, how's this really working?
How, and especially because GoodRx is not something that you have to pay for.
Correct.
Right? It's just
so
a
what's
program.
in it for them?
Right. Well, they obviously are making money, and it's a partnership between them and the pharmaceutical companies, that they're able then to pass off those discounts. But again, when it comes to the Medicare side of the world, I always say medical coverage on Medicare is the cost of medical care is drastically reduced when you're comparing it to having commercial insurance.
Correct.
Like I always use an example of having an MRI. You need to have an MRI of your knee, and you're using your group coverage. You're probably spending about $2,000, right? You are now on Medicare. You're having that same MRI, same knee, and it's probably going to be $200.
Right.
Drastically reduced. However, flip side. Prescriptions. You're taking the same medications as you age into Medicare. The cost of that medication is going to be increased. So the cost of prescription coverage costs way more once you go onto the Medicare side of things, which is why you don't want to ignore your coverage.
All right. Reviewing it every year is very important.
It is very important. Yeah.
Wow. Is there anything we haven't touched on that you think our listeners need to know, and from your vast experience and expertise?
Yeah, I think, if I could just say, especially going into next year, individuals are not going to want to just kind of write out their benefits.
Okay. At work, you mean? Or the benefits on Medicare? On
Medicare, right. Because there will be a lot of changes that are coming up.
Okay.
And so where years past, you might have been able to get away and just say, I'm good, I'm happy with what I have, and I'm really not taking that much. Maybe you're only taking a couple of generic medications.
Okay.
Things are changing in the Medicare world. Pricing on supplements are being re-strategized. Over the next couple of years, you're going to see the premiums on those getting adjusted on the way things are having to get readjusted. There are a lot of things through the Inflation Reduction Act that are going to help individuals on specifically with regards to the donut hole. That's being capped at.
It's my big takeaway today, the donut
hole. That's being capped at $2,000, but then that's going to also change the dynamics of the prescription coverage, and so cost of plans are going to change, and plan availability is going to change. So I always say, especially when you're in the Medicare world, you really have to be a savvy consumer. And just, I always tell my clients, let us help review what you have. If at the end of our review, it is best that you remain where you're at, well, you have that peace of mind. And especially with all the commercials that come out during that time, I think that, I get more clients who call with anxiety and worry, thinking that they don't have everything because there's a new strategy and a new term that they're using on these commercials. And everybody's like, I don't have this. How do I have this? How do I get this? I need this. So I always say, mute those commercials and just talk to somebody that you're really comfortable with, and you know that they're knowledgeable and able to give you all the education that you can. And you're, again, going into next year, it's going to be the one year where I'll tell my clients you don't want to just not review what you have. So.
Well, definitely, I can tell you make the complex simple. So if people do have questions, what's the best way to get a hold of you?
Yeah, so they could call our office or, give out, I really gave out my cell phone number.
If you want to share what number they should reach you out at, and your email, so that way if they, if listeners here want help and they want to contact you directly, feel free. So go ahead.
Yeah, so if you want to give me a call, easiest way is on my cell, because I am, out of the office more. I am in the office, 440-530-0506. My email is rkoloda, so RKOLODA @INSSYS.com.
You might want to repeat that one more time.
Yeah. RKOLODA @INSSYS.com.
Well, great. Thank you so much for being on our show. We're going to wrap things up. I want to thank you so much, Rodika, for being here and sharing your vast expertise, because this is an area, as our clients age and we have clients that have retired, making sure they manage their Medicare and their drug program and all that, it's important because your biggest use of healthcare is in your retirement. When you look at your costs and track costs outside of big events that have happened maybe in your life, as you age, we need more. It's like as our cars, our cars get older, they need a little more maintenance. Your
Right.
medical program and your drug program, you're going to be leaning on that more and more.
Well, it's such a huge part of somebody's picture, right? And you think about, many times if somebody falls into bankruptcy, it's due to what? Medical expenses, right? And especially with everything that you do for your clients, being able to understand their entire lifestyle and all of their needs, and healthcare is such a big part of that. So yeah, it's been such a pleasure. It's an honor to be able to work with you and
Thanks.
service your clients. We really appreciate that.
Well, we appreciate the care you provide our clients. And, I know we focus on a lot of wealth, but we talk about health and wealth in combination because, if you're not healthy, you can have all the wealth you want in the world. But if you're not healthy, it's hard.
Enjoy it.
Yeah, you can't enjoy it. So with that, if our listeners, if we can be of help in any other way, feel free to call us at 877-514-9991, or you can visit us at returnonlifewealth.com. And if you like what you're hearing on our podcast, please send others and help subscribe them as we grow our listener base. Our goal is to provide useful information so that you can make informed decisions that put you in a better position. So with that, have a great day and enjoy your life. Thank you very much.
This has been Frank Wealth Insights, the financial and investment podcast from Return on Life Wealth Partners. Your life, your money, your way. Experience financial planning the way it should be, not the way they want it. See how at returnonlifewealth.com. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision. This communication expresses the views and opinions of the participants as of the date it was recorded or indicated, and such views are subject to change without notice. This podcast is being made available for educational purposes only and should not be confused for any other purpose. The information contained herein does not constitute and should not be construed as an offering of advisory services or an offer to sell or solicitation to buy any securities or related financial instruments in any jurisdiction. This podcast may discuss forward-looking statements that are based on then current beliefs of the participants. Investment advice offered through Planned Financial Services, a registered investment advisor.